Good afternoon, everyone. My name is Dr. Jodie Guest. I'm an infectious disease epidemiologist and professor and senior vice chair of the Department of Epidemiology at Rollins School of Public Health. I also lead Emory's COVID-19 outbreak response team and am the host for Emory's health videos. I am also currently the public health advisor for the city of Atlanta's monkeypox outbreak. And I'm happy to be speaking to some of our leaders across our university today about this epidemic. Today, I'm very pleased to be joined by Dr. Sharon Rabinovitz and Dr. Keilan Rickard. Dr. Rabinovitz is the Executive Director of Student Health Services at Emory and Assistant Professor in the School of Medicine. Dr. Rickard joined Emory just this summer as the Executive Director of Counseling and Psychological Services. Welcome to both of you, and thank you so much for joining me here today.
Thank you. Yes, good to be here.
Thank you for having us.
Absolutely. So we're going to start with some data about monkeypox, and then we're going to be talking very specifically about what we should anticipate for students here at Emory University. So certainly we are dealing with multiple public health issues in the world right now. And today we're going, as I said, focus on monkeypox, trying to focus about university students and what we provide here for our students here on Emory campus. As some background, the WHO declared monkeypox a global health emergency, and the US has now declared it a public health emergency several weeks ago. These are important markers when we think about epidemics in our situations that we're currently living through. Since early May, the US has diagnosed almost 20,000 cases of monkeypox, with 52,000 cases diagnosed across the globe. The US has had more cases than any country almost since the onset of this epidemic that began in April. Additionally, Georgia, where Emory resides, has been in the top 5 states consistently with number of cases. But if we look at cases per population, we actually are currently at number 2 in the country. The majority of the cases in the current outbreak have been in men who have sex with men, though we are seeing spread beyond sexual networks, including more than 30 pediatric cases in the United States. So Dr. Rabinovitz, we're going to start with transmission. There's a lot that's known and a lot that's really different about this particular epidemic, including a lot of stigma and misinformation about spread of monkeypox. So can you talk to us about how you would talk to a student or staff or faculty at Emory about spread of monkeypox?
So monkeypox is not spread easily. That's one thing I would start with, and generally requires close and sustained contact, direct or indirect, through skin to skin contact with scabs or bodily fluids. And usually this is during intimate sexual contact. It can be transferred through fomites, which is when an object transfers virus, such as through towels or through bedding. It can be spread through respiratory droplets during prolonged intimate face-to-face contact, like kissing. So I think those are the things that we want to highlight in the way it's spread. And we also want to highlight that it's not COVID. You know, we've been talking about COVID for so long. And it can be spread through respiratory droplets, but that's not the primary way. It really needs direct contact, intimate skin-to-skin contact for transmission.
And so it's not COVID, which is good news. It's also not a sexually transmitted infection. Is that fair to say?
Yes, absolutely.
I think that that's really an important differentiation as we talk about it, primarily circling the sexual networks right now. That's been a real source of misinformation that we've seen. So let's move on to symptoms. What should someone be concerned about if they might need a test for monkeypox?
So there's 2 different phases of monkeypox. The first is the prodromal phase, which has the fever, the headache, the sore throat, body aches, exhaustion, and can also have swollen lymph nodes in the groin, neck, or armpits. And this is all before the rash. The second part is identified by the rash, which can go through an evolution, starting with red bumps. It can go into blisters or pimples, and it can be anywhere from the face to the hands, and even genital areas. The lesions, like I said, are more can be painful, and they can be on the face and the hands, and that usually extends through the healing phase, which lasts about 2 to 4 weeks.
Which is a long period of time to wait for those symptoms to go away. Those first set of symptoms that you described are really general, and they're going to be hard to pinpoint towards monkeypox. What would you say to someone at Emory if they came to you and said, I've got a lot of fatigue, I've got a fever, I've got a sore throat? What sort of testing should they do?
Absolutely, and we are going to have these scenarios.
Mhm.
So at this point in time, it's, did you take a COVID antigen test at home? That's one thing I would ask. Have you been exposed to anyone with COVID? Have you been any other symptoms that might lead me in a different direction or a different diagnosis? And then we would get into the more intimate questions about contact and knowing anyone who has been exposed, if they've exposed themselves to someone with monkeypox, or someone that they have been with has an undiagnosed rash. So I think walking through the different possibilities in the context of where we are right now in the COVID pandemic, but also, there are other viruses that are still around. There's still strep throat. There's still other illnesses, and students are tired and have headaches. Just from the routine, being a student and
Right.
a lot and having full activities. So I think it's obviously a conversation, a history, and just getting to know the student and making sure that we're covering all our bases as what those symptoms could be from.
And if someone doesn't come to student health and doesn't ask you those questions, what do you want them to be keeping in mind as a trigger to ask for testing?
So it is the rash. And it is the possible exposure. So anyone who has a fever or is not feeling well should isolate right away. And then, because the rash doesn't evolve for 1 to 4 days usually, you really should isolate, be mindful of the fact that you're sick and have some type of illness, and stay away from others. But once the rash starts, that's the trigger to reach out to student health. And you can reach out for the Atlanta campus through the student health portal, make an urgent care appointment, and you will see a provider who will assess and decide if testing is the right thing for the individual, and then go from there.
And are you providing testing at student health?
Yes, we are. We started pretty early in this process. We knew that was something that was very important to have available for our students, especially when they came back.
Okay. And for people who can't go to student health, so faculty or staff or other people, there is testing available in Atlanta. Do you have recommendations about where to seek that?
So it depends on who your primary care doctor is. Many people have stood that up in their own offices. The DeKalb Board of Health has initiated that, obviously. Also, different community programs have started, like Viral Solutions or other entities who also did a lot of response to the COVID, the COVID testing, Peachtree Immediate Care, and so forth. So there's a lot of resources, and this is something that's going to evolve, and we will keep that up to date on our website to make sure that people, for students, but also the resources available for anyone to take a look if there are other resources that people can get testing.
Very good. And Atlanta Strong also has some really good resources on their website about both how to find testing across Metro Atlanta, the broad version of Metro Atlanta, as well as vaccination opportunities for the entire state of Georgia. So that's really important. Let's assume now that we have someone who's tested positive for monkeypox, what do we want them to do and what do we want them to not do? What are the next steps?
So the first thing, if someone is diagnosed with monkeypox, we want them to isolate. We also want them to reach out for support, because one of the things that is important to us is that they know that they have support within student health. We're going to talk to Dr. Rickard also about the resources through CAPS, but also through Campus Life overall, that we will be connecting people to support that they need or require. That is the most important thing, that people are not alone. We have a lot of resources and expertise on campus for people to reach out to if they are positive. Obviously, again, on the medical side, reaching out to make sure that they have what they need as far as medication or pain control, and isolating to make sure that they do not spread, but also being careful not to share drinks or towels or anything else, especially if they're in a setting where there's other people.
these congregate settings at college campuses are, a good place for a lot of spread of infections. Are college students at higher risk for getting monkeypox than other communities?
So we know that university students are social beings, and they do a lot of social activities like big, very packed parties, or sharing drinks or sharing towels, and sexual activity. So the activities of, again, the transmission is by direct close contact, and it happens to be that university students engage in a lot of more of those activities, whether it's intentionally or not intentionally. Just by being in a residence hall, you're around other people, you might pick up a towel by accident or something like that. So we just want to be very mindful of not sharing drinks, not sharing towels, not sharing bedding, anything like that, that can lead to any transmission.
And as we think about all the stigma that's been associated already, so very, very quickly with monkeypox spread and cases, we want to mitigate as much of that as possible. And so we like to talk about harm reduction. So how do we make sure that everyone has the best resources and the best knowledge to keep themselves as safe as possible without being really restrictive? So what are some of the critical things that students can do? You already mentioned some about not sharing towels, et cetera. Is there anything else you would want to add to that list?
Well, I think the most important thing, and I appreciate you saying this, is this is a community response. Everybody has to know how monkeypox is spread, what it looks like, but individuals have to understand their own risk and get support, be vaccinated, ask questions. I think that's the most important thing, to identify your own risk, and whether that changes your own sexual behavior or intimate behavior, that is obviously important, a personal decision. And there are a lot of resources to help people walk through this. So again, this is a community responsibility, and we all have to be knowledgeable, and also assess your individual risk.
I am very grateful for you for talking about community responsibility. We've been trying to talk about that since the onset of COVID, and how important my risk is to someone else. And, in this kind of community compact of we're better together than we are individually, when we care about those who are around us. Can our students continue to engage in safe activities on campus during this particular epidemic?
Absolutely, absolutely. We want to make sure that people are aware and are mindful, but not restricting their activity in an impactful way to keep our community again, the things that we've said with COVID is we want to keep our community vibrant and active and on our educational mission and social mission, and we don't want that to impact it. But education and communication amongst ourselves is really, really important. So I think that's why we're doing this video, to make sure that everybody has the resources and understanding to keep themselves safe and do what they love and what adds to their university experience.
And I think as we've seen, cases across the United States do appear to have plateaued, which is fantastic news. I am cautiously optimistic because universities were not fully open at the time the cases started to plateau. So we can be hopeful that that trajectory stays. But we do believe that a lot of the plateau has been both a combination of vaccination opportunities, vaccine eligibility and availability, as well as education. So education is a huge part of this, and again, why we are here today. I would love to have Dr. Rickard please join us. Hi.
Hello.
We want to talk specifically about some of the services that are available at Emory, and I think as some nice background, we'd love to have Dr. Rabinovitz give us an overview of student health services, and then I'd love to hear an overview of CAPS, and then kind of walk through how some of that will really support students if we see cases of monkeypox on Emory campus, as well as just general support. Dr. Rabinovitz, do you mind starting with an overview of what you lead at Student Health Services?
Absolutely. With regard to monkeypox, we have obviously educational piece is very important to us, and we partner with our other colleagues, such as Office of Health Promotion. But so education starts first, and then testing, bringing people in to discuss their concerns, test, and then isolation. If people, especially on who are residential students, we do provide isolation spaces and make sure that they have meals prepared, towels, linens, basic necessities, basic medications are available. And then we connect them to a case manager, with which Dr. Rickard will talk about further as far as other support networks. The medical team will continuously follow people. Like we said before, this is a long process of 2 to 4 weeks of being in isolation. So we want to make sure that they're connected to their medical team and know that they have access when needed.
Thank you very much. Let's talk about CAPS, including, can you tell us what CAPS stands for?
Yes, CAP stands for Counseling and Psychological Services.
Thank you.
Yeah.
It's a super important part of the resources and the wraparound services that are available at Emory. Can you talk to us about what is available through CAPS?
Yes, so CAPS, or Counseling and Psychological Services, provides individual, group, and couples counseling for enrolled students. We also offer some stress management classes and community outreach to provide support for students on the Atlanta campus. And then Oxford has its own counseling center as well, the Oxford campus. So we can assist them in negotiating emotional and interpersonal difficulties. And we have on-call counselors throughout the day. So on the Atlanta campus, we have on-call counselors from 8:30 a.m. till 3:30 p.m. And then on the Oxford campus, there are folks available from 8:30 a.m. till noon. Then they take an hour for lunch, and then 1 to 5, they're available. And those numbers, I think those numbers are important. So the Atlanta campus, the number is 404-727-7450. On the Oxford campus, it's 770-784-8394.
Wonderful. Having just joined us here at Emory, you've done a good job of memorizing some of our phone numbers already.
I've got my notes here, so.
Totally fair, totally fair. So Dr. Rickard, as you think about the fact that students might, if they are diagnosed with monkeypox, might end up in isolation for somewhere between 2 and 4 weeks, what kind of support would be provided to them through CAPS, whether on Oxford campus or Emory campus, that might be additional to what might be needed routinely?
Yes, so we understand that being exposed to or contracting monkeypox can be super distressing, especially if you have some pre-existing conditions or if you belong to a vulnerable population. So we want to make sure that students are aware not only of CAPS resources but other Emory resources. So let me tell you about Timely Care. So Timely Care is a 24 hours a day, 7 days a week virtual care service. So for folks in isolation, this is perfect. We already have the infrastructure set up for folks to be able to engage in virtual services. So students can engage from almost anywhere, and they can sign up using their Emory email address. And then once they're there, they can choose a different therapist who matches maybe some identities that they hold. And there's also a Talk Now feature. So let's say that you're experiencing some immediate distress. You can use the Talk Now feature to talk to a supportive person right away. And we urge students to use that if they're feeling distressed. So that's Timely Care. We also partner closely with our Student Case Management and Intervention Services Office, or SCMIS. And so what they do is they provide support for basic needs. They're going to provide some follow-up care and other resources. So if you, as a community member, are concerned about a student, you can submit a student of concern form, and then SCMIS will reach out and follow up with the student. But then for students who are in isolation for monkeypox or even COVID, we have a case manager who will be assigned to those students and will be following up with them closely so that their needs aren't falling through the cracks. Yeah, and especially if they have, some complicated, we assume that there are going to be some academic concerns that arise because of isolation. So the SCMIS office is going to be crucial in helping students navigate those academic concerns. Let's see. So moving on to student intervention services, they assist students in times of crisis, not only as an invaluable resource during emergencies, but also as a source of impartial, judgment-free counsel. So we love to refer students there as well. And let's see, there's also the Office of Spiritual and Religious Life. So they offer worship, prayer, meditation, support through spiritual communities, educational programming, confidential pastoral care, and connections with service and social justice efforts as well. So, we've got some services with our partners on campus.
Right.
In terms of what CAPS is going to be able to offer, we are also set up to do virtual appointments. So we do urge students, if they're feeling distressed, like you said, 2 to 4 weeks is a long time. So
It is.
please be in touch and we will offer additional supports if that's what students need.
Wonderful, thank you. And those are incredible resources to have on our campus beyond the need we might have during an epidemic of monkeypox, which hopefully we won't see a big outbreak. I'm sure Dr. Rabinovitz, you're a little tired of outbreaks on our campus.
Yes, we are, but we're here for the students. So
Yes,
we're preparing for what could be.
absolutely. And that's what we want to make sure comes across really clearly in this conversation today, is the preparation and the intention behind the preparation to make sure that we are here to offer the services to anyone on our campus who has these needs during monkeypox isolation, in times of question about whether you should get testing, and even conversations about vaccination. It's really important to talk about vaccinations. They have been a really important part of our prevention and strategy in trying to mitigate cases of monkeypox. Dr. Rabinovitz, do you foresee us having vaccination opportunities on campus, or will that be a referral system?
Thank you for asking about vaccines. Obviously, we know it's a very important tool for any virus and mitigating strategies. We, at this time at Student Health, do not offer monkeypox, but we will make sure that people have an understanding of where they can access monkeypox vaccine. We know it can take time. So we want to make sure that people have updated information as it evolves and more opportunities to access the vaccine come about. So we'll keep people updated on our website with more information.
Wonderful, thank you. And again, I'll do another shout out to Atlanta Strong, which is another site that you can go to that has a QR code that will help take you to any vaccination sites across the state of Georgia, as well as eligibility. And if that eligibility requirement changes in any sort of direction, that would be available for you to find on that as well. Anything last that you would like to leave those who are watching about how Emory is prepared to both support our students and in preparation for potential other outbreak on our campus?
Well, I think one of the most important things that we've learned over this time is that we're better together, and we are very strong if we have the, like you said, the intentionality and the expertise to move these processes and preparations forward. I think knowing that the students have these resources on campus for testing, for isolation spaces, for counseling and psychological services, and all the campus life resources that are, like I said, expertise, experts in this space. I think that's one of the beautiful things about Emory is we have so many experts and people who are passionate about supporting students through anything, clearly, whether it's a pandemic or are now concerned about monkeypox. So again, reach out to Student Health, look at our website. We will update it as information comes about, and just know that we're here for you and nobody's alone in this process.
Thank you very much.
And I would just echo what Dr. Rabinovitz has said. We are very coordinated now in our effort to work with students who may contract monkeypox. So I've been very impressed in my first 3 weeks here that the effort is so coordinated.
Wonderful. Well, we are certainly thrilled that you've joined the Emory community and everything that you bring to our community and to our students. I want to thank you both for everything. Dr. Rabinovitz, for leading us through the COVID-19 outbreak so far. I want to stress that it's not over, unfortunately, but I want to thank you for that. And Dr. Rickard, thank you so much for joining us here at Emory. I am thrilled with all the services that you've discussed today and how quickly you've learned about everything that is offered here at Emory. So welcome to you.
Yes, thank you. And thanks for having us. Yeah, my pleasure.
Absolutely. And for those of you watching, thank you so much. And we hope that you will take this information, recognizing education is so incredibly important as we learn about a new condition that is circulating in our community. Please be safe and enjoy your afternoon.